It's officially 3 weeks post my preventative risk-reducing double mastectomy. Still have this compression belt here to keep all the things bandaged and all, but I feel much better, and I wanted to go through a few questions that I wish I'd known before I went through this mastectomy. First of all is, how does it feel? So I don't have sensation in all parts of my chest. I do have here, but some of these areas here are numb. And the nipples that I don't have any sensation there yet. I guess this might change. The main thing about the sensation right out of the surgery is just a huge pressure. I feel like I'm duct taped all around my chest, and it's not from this compression belt. It's just because of the skin really tight and the stitches and all. So I would take off this compression belt once a day to wash and bandage it again, and it feels like I'm taking it off, but it's still really, really tight. This tightness causes me to kind of walk weird. I walk kind of hunched, and it took me a while to really consciously stand up straight and not like hunch down in everything that I do, even walking. Another thing that I was worried about is how my hands and arms are gonna feel like. What function can I expect in the first few days and weeks after surgery? I was actually afraid I'm not gonna be even able to use my hands to eat. So this isn't the case. I could use my hands to hold a cup of tea and all that from the first day out of the surgery, not the first few hours, but a few hours later. But I did have a big restriction on my arm function. This is still something that I'm not having like 100% function. Up to here, right now, and I'm 3 weeks post, I can't really do this backward motion, and I can't lift my arm more than that. Just taking things from higher places is hard. I can't really carry much because my muscles are really still weak, but this is getting better and better. Arm reach is getting a little better. I couldn't even do that a week ago. So I have to kind of practice this slowly, and I've scheduled a PT session in about a week. I wish I could do it sooner, but there wasn't any availability. Another question was pain-wise. How much pain did I experience? And honestly, this was actually better than I expected. I was let out of the hospital without any opioids, just told me to use over-the-counter pain medications. And I've been using those for every 6 to 8 hours in the first maybe 3-4 days, and then started to taper that off. So like I said, I don't have a lot of pain, but just pressure from this compression and feeling like everything is tight. I did, however, found it kind of surprising that after 2 weeks, I started having pain to my rib cage, and I checked that it is normal, but it's like someone punched me in the ribs all around it. And it's something that kind of started later after a couple of weeks of healing. For some reason, it has to do with nerves or something that's healing from the surgery. And this is even more disturbing me than this pain of the stitches. The hardest thing for me during the first 2 weeks is feeling like I'm dependent on other people. My parents helped me, which is great, but also I felt like I can't do a lot without them. They helped me with the cooking, cleaning, laundry, pick up my daughter, and it was really nice. But even if I wanted to make myself a cup of tea, I couldn't even lift the kettle in the first few days. And the worst thing is that I couldn't wash my own hair for maybe 2 weeks until I could do it myself, and it made such a big difference to be able to do this for myself. So these were the main things that I was worried about. What would be something you would ask and wonder before a mastectomy about the healing process? Comment below and I'll try to answer it.